Umbilical hernia is a common surgical condition seen in calves, especially in Holstein Friesian breed. In this condition, abdominal content protrude through a weakness at the abdominal region. If not treated on time, it may lead to complications like infection or strangulation. Welcome to Nova Vet Care. In today's video, we will demonstrate the complete surgical procedure of umbilical hernia repair in a Holstein Friesian calf. On clinical examination, a soft, reducible swelling is observed at the umbilical region. The swelling increases in size when the calf stents and reduces when pressure is applied. This confirms the diagnosis of a reducible umbilical hernia. Early surgical correction is recommended to prevent complication. The calf is properly restrained in dorsal recumbency. The surgical site around the umbilicus is shaved thoroughly to remove hair. After shaving, the area is cleaned using antiseptic solution such as povidone iodine. The procedure is repeated multiple times to ensure aseptic condition. Proper preparation reduces the risk of post-operative infection. Local anesthesia is administered using a ring block technique around the hernial site. This ensures complete anesthesia during the procedure. Sufficient time is given for the anesthesia to take effect. This step is essential for safe and pain-free surgery. Sterile drapes are placed around the surgical area to maintain a clean field. A careful incision is made over the hernial swelling using along the middle. The skin and subcutaneous tissue are gently dissected to expose the hernia sac. Precision is important to avoid unnecessary damage. The hernia sac is identified and carefully separated from surrounding tissue. The content of the sac, such as intestine or omasum, are examined for viability. If viable, the contents are gently reduced back into the abdominal cavity. If adhesions are present, they are carefully broken down. This step ensures normal anatomical positioning. The hernial ring is closed using appropriate suturing material. Simple interrupted or overlapping suture are commonly used. In this step is critical to prevent recurrence of the hernia. Strong and secure closing ensure long-term success. In this case, we used horizontal mattress suture, and I am used absorbable suturing materials such as catgut or vicryl. If we use unabsorbable suture like as nylon or silk, there are big problems and infection may be occur in future. After closing the hernial ring, subcutaneous tissue are sutured. The skin is then closed using appropriate suturing technique. The surgical suture is cleaned and dressed properly. Post-operative care include antibiotic, anti-inflammatory drugs, and antihistaminic, and proper wound management. The calf should be kept in a clean and dry environment. Regular monitor is necessary to ensure proper healing. With timely surgical intervention, recovery is usually successful. For more veterinary surgical procedure and practical guidance, subscribe to Nova Vet Care and stay connected with us.